News 3 is taking action for your health. I'm Jessica Larche. We're breaking down the biggest health headlines of the week, and we begin with big news about blood pressure and the brain. A study in the Journal of the American Medical Association finds a link between high blood pressure and dementia. About 1 in 3 American adults have high blood pressure. This study looked at 4,800 Americans for more than 2 decades for blood pressure patterns. They studied 2 trends connected to dementia: high blood pressure in midlife around your 50s or 60s that persisted into later life, and those who had high blood pressure in midlife but then developed very low blood pressure in their later years. CBS News medical contributor Dr. Tara Narula explains why blood pressure is linked to several health problems.
That increased pressure is damaging all the blood vessels that supply blood throughout your body. And this is why it's associated with an increased risk of chronic kidney disease, stroke, heart attack, heart failure, vision loss, sexual dysfunction. I mean, anywhere there's an artery in your body that's seeing high pressure, there's potential to damage those cells.
Dr. Narula says the good news here: high blood pressure is mostly preventable.
Reducing salt in your diet, increasing potassium, exercising, controlling your weight, limiting alcohol consumption, quitting smoking. So lots of things that are in your hands to control your blood pressure.
Dr. Narula urges everyone to start getting screened for hypertension even in your 20s and take medication if prescribed. Harvard researchers studying Parkinson's disease say estrogen may one day be used to help delay and reduce severe symptoms. Doctors found male and female lab mice benefited from brain-selective estrogen treatments. New findings suggest aspirin could be beneficial to certain breast cancer patients. Researchers from the University of North Carolina studied more than 1,000 breast cancer patients, and they found the risk of dying was lower among patients who used aspirin and who also had specific DNA characteristics in their tumors. Well, the Trump administration will not approve cancer warning labels on the weed killer Roundup. The EPA says it would be irresponsible to put labels on products not proven to cause cancer. California is being sued by Roundup maker Monsanto for requiring the cancer labels. Monsanto has lost 3 high-profile cases that claimed a chemical in Roundup caused their cancer. 13,000 lawsuits are pending. Now, this may sound like the opposite of something you would normally want to do: pay cash for doctors or medical procedures, even if you have health insurance. But as Consumer Reports reveals, some people are finding out they can actually save money by leaving their insurance card in their wallet.
Most people wouldn't dream of seeing a doctor without using their health insurance.
If my doctor didn't take insurance, I absolutely would switch.
I like the fact that I'm covered for going for a medical checkup.
Okay, give me a big
But with the increasing number of people in high-deductible health insurance plans, some medical service providers are offering discounts, sometimes deep discounts, to people who pay out of pocket.
It sounds counterintuitive, but it's true in some cases.
A company like MD Save even pulls together hundreds of doctors, hospitals, and labs around the U.S., offering discounts to people willing to prepay their bill. It's a practice more common for diagnostic procedures like x-rays and CT scans and even ultrasounds. But the financial team at Consumer Reports found many medical services, including pharmacies and even some outpatient surgeries, are offering discounts if you leave your insurer out of the picture.
It's especially beneficial for people who have high deductible health insurance plans, but you have to be careful. It could cost you more in the long run. That's because when you pay out of your own pocket, that money will not be applied to your deductible or your out-of-pocket maximum. If you need a lot of health care later on, you could be starting from zero.
So run the numbers carefully and decide which way checks out before your next checkup. This is Hillary Palatnik.
Now, Consumer Reports cautions that whichever way the numbers fall, don't skip having health insurance. Health insurance protects you from unexpected costs if you or a family member has a medical crisis that requires major hospitalization or expensive treatments. Well, teenagers may be putting their mental health at risk by spending too much time on social media. In one recent study, researchers talked with 10,000 teenagers, and they found those who use social media at least 3 times a day were more likely to experience online bullying. Researchers also say it cuts down on sleep and exercise, which can also contribute to mental health issues. And keeping your eyes glued to any type of screen could be costing you your vision. That's according to a recent study. Researchers say Americans spend about half of their day in front of some type of screen, whether it's TV, computers, or smart devices. What a lot of people don't realize is they're looking at a phenomenon known as blue light as well. Doctors say there's a lot of risk that comes with blue light. Medical experts say staring at screens all day can lead to sleep problems, blurry vision, and headaches. If you've experienced it and you know those symptoms are real, so one medical expert explains what you can do to avoid those issues.
And just by taking breaks, like every 20 or 30 minutes for about 20 seconds and looking as far away as you can, blinking your eyes and just getting away from the electronics is the best thing you can do.
Experts say a lot of smart devices now send weekly notifications about the amount of time you're spending in front of the screen. There's also special glasses which filter out blue light, protecting your eyes from harmful exposure. Well, vaping is skyrocketing among teenagers. Health officials are now warning about a possible link to severe lung disease. And as Tom Hansen reports, doctors say antibiotics aren't even helping with this.
About 24 cases of suspected severe lung injury linked to vaping have been reported in 3 states in the past month.
These symptoms look like common infections, and they just don't get better.
Children's Minnesota is treating 4 teens ages 16 to 18. The patients did not respond to antibiotics, and doctors say the patient's lungs sustained some kind of injury, and then the lungs began to fail. Some patients required ventilators.
Pneumonia.
Pediatric pulmonologist Dr. Ann Griffiths says the vaping epidemic could be causing serious damage.
The lungs are struggling to deal with these chemicals that are being inhaled, and the body's way of handling that is to send more and more of the immune system to the lungs to try to get rid of something that it's struggling with. And so all that inflammation is causing injury.
The Minnesota Department of Health says patients reported vaping both nicotine and marijuana-based products.
We also know that people have been vaping for years, and so why are we seeing some of these injuries now? My biggest fear is have we been seeing them all along and we didn't know it, because it looks so similar to common diseases.
The American Vaping Association says with approximately 10 million adults vaping nicotine each month without major issue, it appears much more likely that the products causing lung damage contain THC or illegal drugs, not nicotine. The CDC says e-cigarettes are not safe for children and teens. Health officials say adults should be aware about the possible dangers of vaping. Tom Hansen, CBS News, New York.
There is now a new lawsuit in Illinois against the #1 maker of e-cigarettes, Juul, and there are now 3 states that have a public health warning for the possible lung damage in teenagers caused by vaping, but not in Virginia or North Carolina. Well, parents, if you're struggling trying to quit smoking, you may want to consider turning to your child's pediatrician. The journal Pediatrics reports on the power of pediatricians to help parents stop smoking. Parents in this study were asked at the time they checked in for their child's visit if they smoked and if they wanted help kicking the habit. They were then offered prescriptions for nicotine patches or gum, FDA-approved smoking cessation aids. The study found doctors quadrupled the rate of success quitting smoking. Researchers say if adopted nationwide, it would have a major impact on decreasing the number of smokers, and that would enhance the health of adults and their children. Well, data from the Centers for Disease Control show men are more likely to avoid seeing the doctor than women, but a lack of visits to the doctor is putting a lot of men's health at risk. We brought in News 3 medical expert Dr. Ryan Light from TPMG at Greenbrier Family Medicine to explain why this is a dangerous trend. He says many men don't want to go to the doctor because they fear finding out bad news, but he says that only makes it worse.
When you don't treat hypertension or your high blood pressure or high cholesterol or diabetes, those lead to those strokes and heart attacks in earlier life. So you want to make sure you're treating those earlier. Cancers that are out there, if we detect them earlier, treatments are often easier and you have a potential for curability versus later on when we don't have as good a treatment.
Dr. Light says there are signs you need to see the doctor right away. Vision changes, headaches, chest pain, chest tightness, or shortness of breath could be a sign of coronary heart disease or hypertension. Excessive thirst and excessive urination could also be a sign of diabetes. And signs of prostate cancer include difficulty with urination or pain in the lower abdomen. Blood in the urine or stool can also be warning signs of severe diseases, possibly involving the GI tract or kidneys. So we just really encourage everyone to make sure they're getting to the doctor for their checkups. Well, thank you for joining us as we take action for your health. I'm Jessica Larche. Be sure to join me and the entire News 3 This Morning family every weekday morning starting at 4:30 a.m. Until then, we wish you well.